You're definitely going to want to hear this, especially if you're over 60 or you love someone who is. Imagine waking up one morning, just like any other day. You pour your coffee, glance at the news, maybe chat with your spouse. But within minutes, everything changes. Your arm feels strange. You try to speak, but the words come out slurred. Or maybe your vision suddenly blurs. Or you lose balance out of nowhere. These aren't just random inconveniences. They're red alerts from your brain, signs of a stroke, and every second counts. Most people don't recognize them in time. And that delay, it can mean the difference between full recovery and lifelong disability, or worse. But here's the good news. You don't need a medical degree to save a life. You just need to know the 5 sudden warning signs and what to do the moment they appear. In this video, I'll walk you through each sign in everyday language. No jargon, no fear-mongering, just real, practical knowledge. That could help you protect yourself or someone you love. So stay with me, because what you learn in the next few minutes could literally be life-saving. Let's get started. First sign, sudden arm or leg weakness. Imagine a celebrated conductor standing before a grand orchestra, every motion precise, commanding, and graceful. Then, without warning, one of their arms goes limp, failing to respond to the brain's commands. The harmonious performance suddenly disintegrates into chaos. This vivid image mirrors exactly what happens when a stroke strikes: unexpected, alarming weakness or paralysis in an arm or leg. Though it may seem straightforward, an arm suddenly gives out, a leg buckles. There's a hidden complexity behind this simplicity. When muscle control fails, it's not about weak muscles. It's a signal your brain's internal wiring is under attack. Within your head lies a high-stakes circuit. Nerve cells act like electric wires, transmitting signals through specific brain regions, each behaving like a power substation. If the high-voltage transmission line guiding movement to an arm or leg gets cut because its blood vessel is either blocked or ruptures, the signal fails to reach the muscles. You might desperately attempt to lift your arm, but that command never arrives. What's terrifying? This betrayal occurs without warning, in an instant. Many people shrug off sudden limb weakness as mere muscle fatigue. But in truth, it's a critical SOS from your brain. Recognizing it, just as you'd notice a friend knocking over their coffee, can be the difference between recovery and dire consequences. Now, the deeper question: why are these neural highways so fragile? And are we all equally at risk? Or are there hidden threats lurking in our daily lives? The most dangerous invisible culprit is high blood pressure, hypertension, a leading modifiable risk factor for stroke, present in about 3/4 of stroke patients. It severely compromises the brain's microvasculature, small but essential blood vessels that supply key regions responsible for movement, balance, and logic. Persistently high pressure damages vessel walls, stiffens them, and makes them prone to blockage or rupture, leading to strokes and long-term tissue damage. This risk isn't merely theoretical. In the US, nearly half of adults, about 48.1%, have high blood pressure, and only about 22.5% have it under control. When blood pressure remains uncontrolled, often silently, it's only a matter of time before that circuit failure occurs. There's more. Many strokes are silent. No symptoms. No warning bells. These silent brain infarcts are surprisingly common. In older adults, over 20%, and up to 30–40% among those over 70, suffer from them. Studies show such silent infarcts increase the risk of a full, symptomatic stroke by 3 to 4 times. This means your brain might already be compromised yet you're completely unaware. These invisible injuries pave the way for more destructive events later. So what can we do to protect ourselves and our loved ones? Knowing the sign of sudden limb weakness is essential, but not enough. It must be paired with prevention. First, monitor and control blood pressure vigilantly. Lowering systolic pressure by just 10 mmHg or diastolic by 5 mmHg reduces stroke risk by around 40%. Recent 2025 American Heart Association, JOSHI, American College of Cardiology guidelines reinforce this, advocating early lifestyle changes and medication intervention for those with elevated readings, aiming to protect against stroke, dementia, and cardiovascular disease. They also suggest lifestyle strategies, such as trimming salt intake, ideally to under 1,500 milligrams daily, cutting out alcohol, managing weight, and lowering stress, to significantly reduce blood pressure and stroke risk. Additionally, adopting proven dietary patterns like the DASH diet, rich in fruits, vegetables, whole grains, and low-fat dairy, can reduce systolic blood pressure by about 11 mmHg in those with hypertension and 6 mmHg in those with elevated but normal levels, without changing body weight. All this adds up to a powerful message. By recognizing sudden arm or leg weakness, acting fast, and supporting vascular health through daily habits, you hold the power to prevent or mitigate the most devastating stroke outcomes. Remember, the signs may emerge without warning, but our awareness and readiness don't have to. Second sign, sudden facial drooping or numbness. Picture this. You're chatting with someone, a parent, a friend, a neighbor, and suddenly a subtle change crosses their face. One side seems to droop, or they appear numb, almost frozen. If they try to smile, it looks uneven. Perhaps saliva even escapes from one corner of the mouth. This isn't a minor cosmetic oddity. It's a warning signal your brain is desperately sending out. Such facial asymmetry may seem insignificant, but when it appears suddenly, you have no room for doubt or delay. That spontaneous ask, "Try to smile," isn't just a polite gesture. It's one of the most reliable early tests for detecting a stroke. It's embedded in the internationally recognized FAST protocol. F stands for facial drooping. Ask someone to smile and see whether one side of their face lags. Remarkably, studies indicate facial drooping is present in as many as 60% of first-time ischemic stroke cases. That's more than half, yet many people fail to notice or act on it when it happens in real life. Part of the problem is awareness. Surveys show that in general populations, only around 20% of people can accurately identify all the common stroke signs, such as facial droop, arm weakness, slurred speech, while others might fixate on one or two. Improving recognition, even slightly, raises the odds someone will call emergency help when it counts. Imagine talking with your mom or dad. In the middle of the conversation, you perceptively notice their smile looks off, not just for a moment, but clearly visible in how the mouth sags. That pause in your chest, it could mean life or death for them. Still, facial drooping isn't unique to stroke. It can also happen in Bell's palsy, viral infections, or other neurological conditions. Bell's palsy usually develops over hours or days, and often affects only the lower face, whereas stroke-related weakness occurs suddenly, and often includes changes in the upper face. But at the moment, it doesn't matter which it is. You must treat it as an urgent medical emergency. That's why guidelines emphasize that if you see sudden facial drooping, arm weakness, or speech difficulty, call emergency services immediately. Every minute counts in minimizing damage. So next time you notice anything off with someone's smile, don't shrug it off as fatigue or a rough morning. Lean in. Ask gently to smile. If something looks off, Act immediately, because early action can dramatically improve recovery. Third sign, sudden vision loss. Imagine your eyes as more than just windows to the soul. They're also silent messengers of what's happening inside your brain. If someone suddenly complains their vision has gone blurry, they're seeing double. Or worse, they can't see at all, as though a curtain has descended. This is a red flag you cannot ignore. It may be a symptom of a stroke. Eye and vision issues are common after a stroke. Nearly 1 in 2 hospitalized stroke patients, and up to 60% of stroke survivors, experience new vision problems. These can include impaired central vision, issues moving their eyes, narrowing of their visual field, or even neglecting half of what they see. Nearly 30% of stroke survivors suffer specific visual field loss, such as a blind spot in a once normal area of vision. Yet despite these numbers, many sufferers don't recognize or report visual symptoms. Why does vision change during a stroke? It often begins when blood flow to parts of the visual pathway, such as the retina, optic nerve, or visual processing centers in the brain, is blocked. In some cases, a condition known as an eye stroke, central retinal artery occlusion, occurs when the artery feeding the retina becomes obstructed. This can happen because of a blood clot, a plaque fragment, or reduced blood pressure. Without urgent treatment, up to 80% of these patients may end up with extremely poor vision or blindness in the affected eye. This vision loss may happen suddenly and be painless, yet it is as dangerous as a stroke in the brain. What differentiates a stroke-related vision loss from common eye strain or fatigue is the abrupt onset and lack of other explanations, especially in someone with known risk factors like high blood pressure, diabetes, heart disease, or carotid artery narrowing. Studies show that about 30% of stroke patients suffer lasting visual impairment, including disruptions like hemianopia, loss of half the visual field, double vision, or weakened eye movement control. Recovery is possible, but many face permanent changes without proper rehabilitation. Picture this. You're reading the newspaper beside your spouse, and suddenly they turn it away, complaining the words are blurry or doubled. It doesn't improve. It may not be just a tired morning. It could be a stroke silently stealing their sight and brain function. Vision loss during a stroke can result from damage to the brain's visual processing center in the occipital lobe, or from disrupted coordination of eye movements controlled by cranial nerves in the brainstem. Lesions can result in misalignment, double vision, impaired focus, or visual patterns that simply vanish. Even temporary vision loss, like a brief episode of blindness in one eye, called amaurosis fugax, often foreshadows a stroke. It may result from tiny blood clots or plaque fragments that temporarily cut blood flow to the eye or brain. These episodes, though fleeting, are warnings of more serious events to come. What can you do if someone experiences sudden vision change or loss? Act quickly. Call emergency services immediately. Just like with other stroke symptoms, time is brain. Treatments exist, such as clot-dissolving medication or pressure relief in the eye, but they're most effective when administered early. To sum it up, sudden vision changes, whether it's blurriness, double vision, or complete loss, are urgent brain signals that demand immediate medical attention. Act fast, because the quicker help arrives, the better the chance of protection, recovery, and preserving sight. Fourth sign, sudden loss of balance. Picture this. Your loved one is walking along as usual, and suddenly, out of nowhere, they stumble, latch onto a nearby wall for support, and complain of terrible dizziness, as if the entire room is spinning. Don't dismiss such an episode as just dizziness. When balance vanishes in an instant like that, it's your brain sending a desperate SOS. Yes, many older adults experience occasional dizziness, often tied to benign causes like dehydration, low blood pressure, or even minor inner ear infections. But what sets apart a harmless wobble from a terrifying warning sign is both how sudden and how intense it feels. Being able to distinguish between common dizziness and something more sinister could be the difference between ignoring a symptom and taking action that changes a life. Posterior circulation strokes, those affecting the back of the brain, often manifest with sudden vertigo, imbalance, and coordination problems. Sudden dizziness and loss of balance are classic signs of strokes impacting the brainstem or cerebellum, where critical functions for coordination and equilibrium are located. It's important to recognize that isolated dizziness alone, without accompanying red flags, often suggests a non-stroke cause. But when imbalance joins that dizziness, the odds of a stroke or transient ischemic attack, mini-stroke, become significantly higher. Even for experienced doctors, it is not always straightforward to tell whether dizziness is benign or the beginning of something more dangerous. But when it strikes with intensity, at once, and with no clear reason, especially in someone with known risk factors like high blood pressure, atrial fibrillation, or diabetes, that is a red flag you cannot ignore. This is why many stroke experts emphasize the expanded BE FAST rule, which builds on the traditional FAST protocol. In addition to face, arm, speech, and time, B FAST adds balance and eyes. That extra B highlights that sudden loss of balance by itself is a key stroke warning sign. Imagine walking in the living room with your parent, and then, without warning, they pause mid-step, stumbling and looking genuinely disoriented for a moment. That's your cue. Do not wait or question it. Call emergency services immediately. Time is absolutely critical because every minute of lost blood flow can mean more brain cells lost. Delayed action could lead to permanent brain damage, long-term disability, or worse. Strokes remain a leading cause of disability and death, and one occurs every 40 seconds in the United States alone. Of course, there are non-stroke causes of sudden imbalance, like inner ear issues, benign vertigo, dehydration, or low blood pressure. But without medical evaluation, you can't know which is which. Some of these conditions are treatable in non-emergency ways, but only a professional evaluation can guide safe, effective care. In the moments while you wait for help, ensure safety. Help them sit or lie down in a stable spot, minimize movement, and stay with them. Don't delay action by trying to diagnose yourself. The earlier treatment begins, whether clot-busting therapy, blood pressure control, or emergency intervention, the better the outcome. Fifth sign, sudden trouble speaking or slurred speech. Imagine being in the middle of a normal conversation when suddenly your words won't come out right. Your tongue feels heavy, familiar phrases sound strange, or nothing comes out at all. This isn't simple forgetfulness. It can be the brain's urgent warning of a stroke. Speech changes are one of the most common stroke symptoms. Nearly half of stroke patients experience them, whether it's slurred words, jumbled sentences, or an inability to understand what others are saying. What makes this especially dangerous is how often it's ignored. Families may assume someone is just tired or confused, but every minute matters. Losing those first critical 60 minutes, the golden hour, can mean permanent damage instead of recovery. A simple test can help. Ask the person to repeat a short phrase like, "The sky is blue today." If their speech sounds slurred, incorrect, or they cannot repeat it at all, it's time to act. Call 911 immediately. Quick recognition and response can preserve both life and communication. The reason speech falters in a stroke is because areas of the brain that control language, such as Broca's or Wernicke's regions, suddenly lose blood flow. Without oxygen, these centers shut down. In left brain strokes especially, this can cause aphasia, where the person can't form or understand words, or dysarthria, where their speech becomes slurred. The good news is that with fast treatment and rehabilitation, recovery is possible. Most improvement happens in the first few weeks, though therapy can help even years later. The key is speed. The earlier the treatment, the better the outcome. So if you ever notice sudden trouble speaking, don't hesitate. It's not aging, and it's not tiredness. It's the brain in crisis. Acting quickly can save not only a life, but also someone's ability to connect with the world through words. But here's the truth. Just knowing how to fight the fire isn't enough. We also need to become smart fire preventers. Everyday choices quietly determine whether we are protecting or damaging our brain. Take diet, for example. Every greasy fast food burger, every sugary soda. These aren't only adding inches to the waistline, they are also silently choking the blood vessels that feed the brain. Over time, this damage encourages plaque to build up, narrowing arteries and setting the stage for a blockage. And when those blockages occur, the brain cells responsible for speech, memory, and movement are the ones that pay the price. Then there's the issue of inactivity. A sedentary lifestyle, sitting in front of a screen for hours with little movement, doesn't just weaken the body. It reduces healthy circulation to the brain, starving it of the oxygen and nutrients it needs. Just as the heart benefits from exercise, so does the brain. Movement is mental medicine. And we cannot forget stress. Modern life is filled with pressures, but chronic stress doesn't simply make you tired. It sparks a chemical chain reaction that raises blood pressure and strains blood vessels. In a very real sense, clinging to stress may be squeezing away your future ability to think, speak, and connect with loved ones. That's why prevention is always better than treatment. But if a stroke does happen, the best and most important action is simple. Call 911 immediately. Time is brain. With every passing minute, millions of irreplaceable brain cells are lost. Why call 911 instead of driving to the hospital yourself? Because paramedics can begin life-saving treatment on the way. They know which hospitals are certified stroke centers, and they alert the staff in advance, so that critical care begins the moment you arrive. Driving yourself only wastes time and increases danger. One vital detail: try to remember exactly when the first symptoms appeared. This helps doctors decide whether treatments like clot-busting drugs are possible. And don't ignore mini-strokes, known as TIAs, or transient ischemic attacks. Even if the symptoms fade in minutes, a TIA is often the strongest warning that a major stroke may be coming soon. Always treat it as an emergency. Call 911 without delay. While waiting for help, stay calm and reassure the person. Help them lie down safely, slightly elevating their head and shoulders. If they feel nauseous, gently turn them to the side to avoid choking. Never give food, drink, or medicine unless specifically instructed by emergency dispatch. Finally, prepare for EMS. Unlock the door, clear the path, and if possible, have a list of their medications ready. Remember, knowledge is power only when shared. If this message helped you, please subscribe to Senior Health Guide and share this video with family and friends. You never know, you might be the one who saves a life.